you can see, if you're looking to apply to medicine or dentistry in 2026, so if you're in year 13, or if you're even in year 12 at the moment and you're looking to apply in 2027, we're trying to brand this webinar as basically the only webinar you're going to need for the year. We're going to cover everything in it today. So we'll start off with a bit of just what is the UCAS application, what do you need to know about applying for medicine and dentistry. Then we'll move on to a bit about interviews, a bit about UCAS track, a bit of offers, what to do when you get your offers. And then finally, we'll round it up with a bit of just general A-level advice and what we've got coming up in the year. Okay, so what is our mission statement at Dention? So myself and Syed, we're both gap year students. So we didn't get in first time round to medicine and dentistry. But what we noticed is during our gap year, there wasn't enough help. And if you are doing a bit of your own research and trying to find things online on the web, what you probably have noticed is that the advice is often very generic, or it's very far-fetched, or it's very basic. And especially if you're on a gap year, as we were, and we encountered this during our gap year, it's not enough to help you get into your desired medical or dental school. And that's basically what led to the formation of Dention and how it all came to be. So we have got these 3 main bullet points in terms of our mission statement, and obviously these will change as we go along. But you can see what we're trying to do really is make medicine and dentistry careers accessible for everyone. We don't believe that it should be, oh, if you have the best access to education or the best support, only you should get into medicine or dentistry. We completely don't believe in that. We're trying to make it accessible for everyone. And what we're also trying to do whilst we're doing that is create a team and culture that we're proud to belong to and represent. So that doesn't only mean for us as the team members of Dention, but also for you guys that are here with us today and that are also going to be joining us on later events as we go out through the academic year. So you have that sense of belonging and that point of call to call upon people if you do feel you need that help. And then the last one is just really, we're trying to really change the way the admissions tutoring process is done. We do know there are those couple of big companies out there that are doing it, and they're doing absolutely fine. But we're trying to do it in a different way, put a different narrative on it, and make it in a more specific and applicable way to you, so you know that every advice we give is basically tailored. Okay, so that's a bit about us and just an introduction. So now we're actually going to move on to everything that you're here for, basically. Okay, so applying to medicine dentistry, you can have a look at, like, we've created a time frame here. So if you have a look at this, you can see where you are basically. So obviously this starts from January and it goes all the way up to September or August when you get your results. So if you're in year 13, you will be just about here, obviously. You'll be close to this October deadline now. Obviously, 15th of October is when the UCAS deadline is approaching. I know you're all quite aware. You've got a couple 14 days to go. But if you're in year 12 and you're looking to apply in 2027, you're going to be more down the end of this side. So if you are in year 12, you could be looking to get into some work experience. Again, we'll come on to this a bit later on, how to get work experience and what you actually need to do with work experience. But you should essentially try to get work experience as early as you can, really. Whereas if you're around here in year 13, so you've obviously done your UCAT. We all know that the UCAT result deciles did come out today. So if you haven't had a look, do check the UCAT website and all the decile results are on there. But more importantly, now you're pretty much finalizing your application and now looking to submit it into UCAS. And then you're going to be moving on to some interviews. Then you'll be moving on to after your interview season. So interview season stretches from November to April. Obviously, depending on what university you apply to, it's quite a long range. So some universities, for example, when I applied to Manchester, my Manchester interview was basically at the end of March. So some universities do them really early on, but some do them quite late on. So it's quite a big time frame of interviews. And then obviously after you have your interviews, you'll have your offers coming in. That'll be through UCAS track. And then by about May time to early May to end of June, you should be looking to accept your offers, really. And then moving forward, obviously in year 13, you'll have your results day and you'll have your A-level exams that you're sitting. And then end of September or mid-September, obviously depending on Freshers Week is, you will be looking to start university. So yeah, that is basically the grand picture. It's the application time frame. And this is where, whether in year 12 or if you're in year 13, this is where your next year or 2 years are basically going to go if you are looking to apply for medicine and dentistry. Okay. So moving on, obviously I touched a bit on work experience earlier. The main question we always get is work experience. Is it really needed? Now, what we always say at Dention, or everyone that you can speak to, what they will always say is that the work experience is used in interviews. So it's not necessarily a tick box that you need to have to apply, but when you do go to your interviews, they will be asking you about your work experience. And what they want to see in those interviews really is they want to see that you've got a general understanding and an insight of the career that the applicant has applied for. I actually did grab this off one of the university's websites, and this is what they say they're looking for with work experience. So they're not looking to see what sort of doctor you've shadowed or what sort of dentist you've shadowed, what sort of procedures you've seen, but they really want to understand, and they, more importantly, they want to know that this person sitting across the table, are they a candidate that we can see that has done their research into the career and understands the pros and the cons, and they've got a realistic expectation of what a general day-to-day career will entail in medicine and dentistry. So it really does, again, come down to that point of quality over quantity. Universities don't require a specific minimum amount of work experience. So they won't say to you that, oh, you need, I don't know, like 15, 20 hours, or even they won't say that you need 2 weeks, 3 weeks worth of work experience. What they really want is that ability for you to reflect on it and just show that you have got those qualities that you possess to make you a good doctor or dentist. In terms of a tip for work experience, and we get asked this quite a bit, because if you can imagine, if you go back to that time frame I showed you, if you're in year 12 and you're looking to start your work experience now, well, you've still got a year and a bit, really, or just a year and just over a year until you go and sit your actual interviews. So there's no way that, no matter how amazing you are, you will struggle to remember everything that you saw and every patient interaction. So one of the key things that we can say is really make a note of any interesting consultations that you have whilst you're shadowing, or even any interactions you've had with patients, or just any general things you've seen, so that you can have this in the log. So you can say, on this day, I saw this. And then when you're doing your interviews, you can basically bring it back up to your interviews when you're getting interviewed, basically. And as we can see here, as a general rule of thumb, we recommend that you try to have 2 weeks of clinical shadowing. So this could be, for example, if you're looking to do medicine at university, this could be in a care home, this could be in a GP, or it could be even be in a hospital if you're able to get a placement. So that can be your 2 weeks of clinical shadowing. And obviously, if you're looking to do dentistry, the most common way to do that is just to go to a general dental practice and ask for some shadowing, just so you can see the day-to-day procedures. And then what we also recommend is, unfortunately, in this day and age, as the landscape is changing, it's not enough just to have your work experience in terms of having it in a clinical setting. What universities are now also looking at is they want you to see that you've got that long-term commitment of volunteering. So obviously in your work experience, you'll be shadowing. You may get the opportunity to speak to some patients, but it won't be that every patient you see, you're speaking to them. Whereas with the volunteering, number one, what it shows to universities is that you're able to hold a long-term commitment. You're able to commit 6, 12, however many months you're doing a year. You're able to commit just to be going regularly, whether that's a couple of hours a week, or even if it's, I don't know, like maybe once every fortnight. It just shows that you're able to commit regularly to your volunteering, and it shows them that commitment. It's just one of those things that universities do like to see. And then on top of that, if you still don't think that's enough, you can try to get a paid job. So obviously, as you probably are all in year 12, year 13, or in a gap year, you are now pretty much able to work. So it doesn't really have to be, I mean, it would be ideal if it's something related to medicine or dentistry, but anything really. For example, whilst I was applying to medicine dentistry, I had a job as a tutor. And you may be thinking, actually, how is that related to medicine and dentistry? But what you will realize is that you're able to pick up on these key things from your roles as volunteering or in paid work. So for example, with my job as a tutor, what it really did teach me is how to communicate and how to really speak to children from young up to children that are sitting their GCSEs. It just teaches you that communication really. Okay, and what we said is just try to complete the clinical aspect of work experience in the summer that you sit the UCAT. So obviously, if you're in year 13 now, your work experience should pretty much almost be finishing now. You should have got the most of your work experience done. But if you are in year 12, what we would say, obviously we'll come on to it later, you'll have your UCAT coming up in summer. But even now, you can start to look for your work experience and try to just get it done as early as possible. So that's a bit about the work experience. So overall, yes, it is needed. It's always quality over quantity. You don't need huge amounts. It's more on how do you reflect on it. And the main point is that there's not a tick box in your personal statement or in the forms that you submit to uni saying, I did this amount of work experience. It will come in the interviews and you'll be assessed on it and they'll ask, what did you see in your work experience and how has that informed you to do medicine or dentistry at university? Okay, moving on. So I talked a bit about UCAT just before, and if you're probably in year 13, you're probably well aware of what the UCAT is, and I hope it all went well for you guys that sat the UCAT in the summer. But if you're in year 12, you are probably thinking, what is this UCAT that he keeps going on about? So if it isn't already as hard as you think it is, you have to sit the UCAT. And what the UCAT is, unfortunately, A-level grades are not enough, predicted grades are not enough. It stands for the University Clinical Aptitude Test. What they're looking to see basically with this test, it's a 2-hour test, and what they basically want to see is how developed are you in certain areas. So there are 4 sections on there. I'll just bring it up here. So it's 3 sections. It's 1 hour and 57 minutes and 30 seconds, and it is a computer-based test. So you have these sections on there. So there's 3 main sections, and then you have the SJT as well. So the VR is verbal reasoning. It's basically just reading passages, comprehension, and answering questions based on it. And then the next section that you have in this is something called decision making, which is a DM. And you can think of this as numerical reasoning and testing your IQ, really. You're looking to see how logically can you think. And then the next section is a QR, which stands for quantitative reasoning, which is basically just a full section on maths. They'll ask you lots of maths questions and they want to see how well you do it. So they're the 3 main sections for the UCAT. And then there's also another section in there, which is called the SJT, which stands for the Situational Judgment Test. So what this basically is in this section of the UCAT test, when you're doing the UCAT, you'll be given a huge range of questions related to clinical medicine or dentistry. So they'll give you a scenario and they'll say that you are this, say for example, you're an F1 doctor on your first day after graduation, and this patient comes in, and then they ask you to, and then they'll show you the action that you'll do in that case, and they'll ask you to rank it. So it's just clinical based questions for it. One tip I would give you for the SJT is there's something called the General Medical Council and the General Dental Council. These are basically all the governing bodies that govern us when we qualify as medics and dentists. And they've got on their website a document which basically breaks down how an ideal doctor or dentist should be. And these SGT questions that you'll do in your UCAT, the questions are formed from this document. So when you do come to do your UCAT, if you are in year 12 now, I would say definitely give the GMC document a read. That will basically help you in your SJT. Okay. So you can see it says here that UCAT booking opens in late June and that last testing date is late September. So what we're trying to say, if you're in year 12, you'll finish your year 12, you'll do your exams before you break up for summer, and then you can book your UCAT test. What I would say is spend most of your summer revising for the UCAT, and then you can sit your UCAT just before you go back to school. And it's a UCAT is almost, you only get 1 chance to sit it. So it's not a test that you can keep taking again and again. You have 1 chance per year. So unfortunately, there are sometimes cases where if you don't come out with such a good score or you don't think you've done as well as you would have hoped, you can't really sit the test again. It's basically just the one chance and you just have to give it your all. There is one more thing that I want to highlight here, is that as you can see here, it says some universities do not require the UCAT. So again, as you are, either if you're in year 13 or if you haven't got such a fantastic score as you're hoping for, that is one of the key things I want to tell you, that some universities don't require it. Obviously, you need to go away and do your own research, and you can have a look at it and see which universities don't require it if you got a slightly less than good score that you're hoping for. Okay. And then my advice is, obviously, it's probably a lot to take in if you are in year 12 at the moment, but don't leave the UCAT until September when you come back to college or sixth form. The reason I say that is basically because after you come back in year 13, you will have the majority of sixth forms or colleges, they will have another round of tests, which will form your predicted grades. So it would be nice if you could get your UCAT out of the way just maybe a week before you begin a sixth form or college again. So that way you're not having to worry about your UCAT prep and also the A-level exams that you have going back. And each section scores obviously range from 300 to 900. And the way they actually calculate your final score is, so say, for example, in verbal reasoning, if you get 600, and then decision making, if you get 500, so that's 1100. And then say for quantitative reasoning, you get 400, for example, that's going to give you a total score of 1500. So they add all the scores up together. And then after you finish your test in that UCAT test center, you'll get a printed out sheet with your result on there. Okay, and yeah, as I said, the SAT is a hypothetical scenario. And one more thing is that it's ranked in bands. So basically, the better you do, or the more close you are to how the panel of doctors think when they're forming that GMC document, the higher you will be up. So band 1 is the best, band 2 is slightly below that, and then band 3, and then band 4, so on and so forth. But yeah, and then one of the key things that we really want to demystify today in terms of the UCAT is, obviously with the application cycle just gone for the UCAT sitting, I've seen a couple of people saying, oh, we got the same questions for the UCAT. Not everyone will have the same questions. What the UCAT consortium, the people that make the UCAT test, which is Pearson, they have a bank of questions. They just have a question bank, and you randomly allocated the questions on the day, if that makes sense. So you may get 1 or 2 questions that are similar with someone else, but obviously it's not the same test, so you won't all have the same questions basically. But yeah, so some places that you can use in terms of for UCAT prep. Obviously, if you are in year 12, this will be going on into next summer now. The ones that we've used and we recommend really is Medify is basically the gold standard. I mean, I've used it myself, and I think Syed UCAT. It's basically a complete platform, and it's been trusted by thousands of students that have now got into medical and dental school. So we do really recommend that. And then another one that I want to recommend as well, and I did personally use this when I was starting out on the UCAT, is Pass Medicine. So with Medify, there's a subscription. I think it's about £50 a month. But Pass Medicine is completely free. So you can register for the UCAT bank there, and you can just do some UCAT questions on that before, if you want to move on to Medify. And then coming on to the last 2 tips, is try to practice in the same environment that you're sitting the real UCAT. And I know this seems like a very generic and basic advice, but I just thought I'd include it in here because you won't believe the amount of students that they don't give it the enough due diligence when they're sitting the UCAT. You can imagine. So in the UCAT, when you actually sit the actual UCAT exam, you'll have a PC, you'll have headphones or earplugs, depending on which person center you're in. You'll have a full-size keyboard. So you won't be doing it on a laptop, you'll be doing it on a PC with a keyboard. And you'll also be given a whiteboard and a pen. So you won't have a physical calculator, and you won't have a biro pen or a paper. So what we do recommend is try to get used to this environment whilst you're at home. So for example, you've probably picked up on the fact that there's going to be no physical calculator. So for the quantitative reasoning, you're going to be given a calculator on the screen. So you need to make sure that you are adequate enough to use that. And I could go on about this, for example, for anyone that's doing psychology at the moment in A level, you obviously have that theory of context-dependent memory. Basically, just revise in the same environment that you're going to be setting yourself up in to do the actual test. And obviously, try to take full-length practice tests like the mocks on Medify and Pass Medicine. and then just do it in time permitted materials, basically. Okay. So just want to give you a quick breakdown of how the UCAT is. So obviously we talked about it before in the last slide, but these are the breakdown of the UCAT. So you can see here in terms of timing. So there's 184 questions in total, and you may think that seems like a lot, but the majority of the questions, if you look come from the SJT. And now, if I'm being completely honest, the SJT you can basically finish in 20 minutes or 15 minutes if you're really good and you know that GMC document inside out. So this is the order it's gone in. Like I said, verbal reasoning first, then decision making, then it moves on to quantitative reasoning, then it's SJT. So I'm not going to read out the questions, how many questions are in times and the time for it. I'm sure you can see that. But yeah, that's the breakdown for it. And so just have a look at this question. This is if you are in year 12, this is a mock. This is like an example question that you'll get for the VR in the UCAT. So you can see how it's laid out. This is the type of layout you get. So you can see here that you've basically got your passage, and then you've got your actual questions that they're asking you along the side. But I'm not going to go through these today just because of time. But what I will say is, if you see this little QR code up here, we did do a UCAT tip, like UCAT tips and tricks walkthrough in summer. So if you want, you can scan this QR code and it'll bring you up on the YouTube channel and you can work through it. There's just a couple of tips and some walkthrough with some example questions. And then again, this is decision making. So you can see how this is more of a logical based question, obviously very different compared to the VR. But you can see, for example, here it says, in a mixed gender school, all students must study at least 2 foreign languages out of French, German, or Spanish. And it says no boy studies all 3 foreign languages. So they just want you to put yes or no in each of the box, and then, yeah, you just take it from there. And then moving on to quantitative reasoning. So this is your math side of things with the UCAT. So you can see the type of math questions you're going to get. You're going to get tables. You're going to get like economical questions. You're going to get percentages. So these are all the things that you should be thinking about when you are preparing for the UCAT. And again, you can scan that QR code there, and it'll bring you up on YouTube. And I've done a walkthrough of some of these questions. And then moving on to the SJT. So this is the one that had the 69 questions in. So you can see that type of questions you get. So we've got one for dentistry here. And then I think I've included one for medicine here. So again, I'm not going to read it out. But what I'm saying is it gives you a breakdown of the scenario. And then it just tells you how important to take into account are the following considerations for SEMA when deciding on how to respond to the situation. And then you just basically say how you think it is. Is it very important, of minor importance, or not important at all? And then you banded 1 to 4 on the SJT. Okay. So that's the UCAT test done. The next thing is, after you do the UCAT, you will get obviously your slip in hand and you'll have your score on there in the test center. So the question is, what is a good UCAT score? I'm going to caveat this saying that it's not the same every year, obviously, because you'll be applying with your own academic year. Every academic year changes. So you can see, for example, in 2019, so this 2800, you're probably wondering, why is it so high? But this was the old scoring. I'll come on to it in a moment. But in 2019, the average, a good score, so that's 90%. So that's basically the highest decile you can get. It was 2800. And then you can see that in 2023, so moving forward 4 years, it went down to 86%. So you can see that I'm just trying to prove to you that the UCAT score does change year on year for what you need. So obviously last year, they got rid of the abstract reasoning. So obviously if you're in year 13 this year and just done the UCAT, I think you were the first year that didn't have the abstract reasoning in there. So the abstract reasoning was basically just shapes, and it was asking you to find patterns. So that's why these scores are slightly higher than what you can get now. So going forward now, what I would say is that you're looking basically for a score of 1900 or 1950. So remember, you add all 3 of the sections up. The SJT doesn't give you a number, rather band. So you add up the score for each 3 of your sections, and then that will combine your score. And then on average, we say, again, take it with a pinch of salt. you're looking at about 1900 to 1950 for a good score. Okay. And then obviously for SJT, some universities stipulate that they won't consider you below band 2. So if you've got band 3 or 4, they'll just reject you straight away. So to be on the safe side, you really are looking for band 1 or band 2. It's very rare to get band 1, to be honest. There's obviously people do get them, but the majority of the UCAT sitters, they either end up in band 2 or band 3. And band 2 is completely fine. I mean, for example, myself, I got band 2 in SJT and I got an interview with it. So band 2 is absolutely fine as well. The other thing that I also want to touch on is that some universities already have a cutoff. So what they can do is they will basically say that all the people that will apply, they'll just take the top 300 and they'll just cut it off there. So anyone below that UCAT score of the top 300, they won't get called to an interview. So it's just, again, it just depends which way the university do. You're going to have to do a bit of research on this yourself. But again, there are a couple of things on the Dention website for this as well. And some universities, for example, they will set a cut-off score. So rather than ranking everyone from the highest UCAT score to the bottom and saying we're only going to take in 300 for an interview, what they will say is rather than just choosing 300 people, actually what we'll do is we'll set a UCAT score. So anyone that's above 1900, even if that's 600 people, for example, you'll still get invited to an interview. So it just depends which way does the university do it. And as you can see, again, average UCAT score is 1900 roughly. Okay, so this is just a historical breakdown of how the UCAT's been changing. So again, just proving that year on year, you can see that the average does change. So we went from 633, 631, so on and so forth. But yeah, don't look into this too much because this is the old UCAT data. Obviously, we moved forward now, getting rid of the abstract reasoning. So what I would say is look for around 1900 as a good UCAT score for that year. Okay, so in terms of revision day for UCAT, if you are in year 12, you're probably wondering that I need to do a bit of UCAT prep coming up in the summer. What we would say, try to do 1 mock a day. SJT doesn't really need that much of a work. Like I said, if you just read that GMC document, even if you are a dentist, for example, looking to apply for dental school, it's still the same thing. So the SJT document is fantastic, and that should pretty much be your SJT revision. And then the other 2 things that we also want to say is just try to alternate between each 3 of the sections. So when you are starting off quite early on, you don't just need to do 1 thing a day, obviously. Just try to switch it up. So do some QR questions, do some decision making, then do some verbal reasoning questions. And then as you get close to the exam, obviously, if there's something that you feel like you're lacking on, you can work on that a bit more. And then switch it up. Revision, let's be honest, it really can get boring sometimes. So you have to make it interesting for you, especially when it's during summer and people are away on holidays or people are working, for example, earning money, and you're inside doing UCAT. You need to make sure that you're making it a routine that isn't boring, and it's a easy way out for you to say, oh, the UCAT prep's boring, I'm not going to do it. So switch it up, do a mock maybe one day, do something else another day, or just have a day where you're just doing SJT or you're just working on short mini mocks, for example. But you don't have to do a mock every single day. Obviously, as you're getting closer to the UCAT test date, we do recommend it. And yeah, this is a QR code. I'll just put it in here once more. If you want a bit more UCAT help, you can take it from there. It's just a YouTube video, and we've just broke down some tips for you. Okay, I'm going to pass over to Syed now. He's going to take over now from here, and he's going to talk a bit about personal statement and UCAS for you guys.
Thank you for that, Aarij.
No worries.
So there's a question in the chat as well.
Yeah.
When should we start revising for the UCAT? So if you want to give an insight to that, please.
Yeah.
Before then, I'll take afterwards.
That's okay. So as I think I did touch on it before, but if you're in year 12 now, so you just started year 12 now, you sit your UCAT in the summer before year 13. So if you know what, I'll actually go back to the application time frame. I think it'll make more sense that way to explain. Just running through everything again. Okay, so if you can see here, so you can see that UCAT booking opens around mid-June time, okay? And UCAT testing starts in early July. The last date for UCAT testing is basically September. Again, it varies year on year, but it's around middle of September. So you've got all that time from June to September to basically book your test and do some revision for it. What we advise at Dention is try to sit your UCAT just before you go back to college or sixth form, because granted, like we mentioned before, you are going to have those A-level exams coming up again. So that'll form your final exams for your predicted grades. And you'll be back you're in year 13. Year 13 is a really busy year. You'll be back on Thursday and you'll already be getting going and picking up with where you left on summer. So what we recommend is sit it a week before you start your year 13. And ideally anywhere around August, mid-August, late August, just anywhere before you start college or sixth form again. And then you can just book it as soon as it opens, really. The more time you have, the better it is, really. So say if you book it in June, as soon as it opens, say you get a test for around mid-August, you can really start preparing in July. About a month, really, of good solid revision is enough, I think. As long as you are doing revision every day and you're going over the UCAT questions, it should be enough to set you up for a good score. So give about a month and a bit, and then you can sit it just before you start year 13. Okay, right. So I'll move you back onto the slide that Syed was going to take over.
Perfect. Thank you so much. Okay, so personal statement and UCAS is a big part of your application. What will basically happen is that I mentioned in the chat, but you are assessed holistically, right? The application process is where they'll look at every single aspect, not just your A levels, not just your GCSEs, not just your UCAT. So in your personal statement, it's basically where you tell them why you want to study that course, or why you want to study medicine, or dentistry. So the personal statement is basically 4,000 characters. It's characters, not words. There's a difference. So it includes spaces, commas, etc., etc. And it's just to tell you, okay, why you want to study that certain course. Before you had like an essay type to write, but now they've changed it to UCAS where you only have 3 questions. So there are 3 questions that you'll have to answer. And those questions will be, why do you want to study on this course? How have your qualifications and studies helped you prepare for the course? And what else have you done apart from the education side, outside of your course, to make sure that you're good for this course, basically. So those are the 3 main questions that you're going to be asked. Your personal statement shouldn't include it should include but not be limited to why medicine. It should also go outside, like your experiences, what you've done for the course, why you're interested in the course realistically, what's your motivations, why you determined to do it. And those are the main things that you want to write in there. You don't want to include stuff about a specific university. You want to be general and like basically talk about why you basically want to study that course, no matter what university you want to go to. And that's basically a quick summary of your personal statement. With the UCAS side of things, right, you can only select 4 medical or dental schools, right? You have 5 options in total, but you'll only have 4 that can be part of medicine or dentistry. You realistically can't do medicine and dentistry both in the same application. So you'll have to do 4 medical schools, and then a third one can be, for example, a backup. It's called insurance, right? It's your insurance where they'll be something like biomedical sciences, pharmacy, something that isn't medicine related, basically. So that's the 4 options that you'll get. And in the personal statement, you want to make it personal to you. You don't want to make it personal to anyone else. You want to basically go as deep as you can to basically convince the examiner, convince the person that's reading your personal statement is why you want to actually do it. Make it as personal as you can. The more personal that you can get, the better it will be for you. Okay, so we're gonna have like a quick little exercise just to make it a little bit more interactive as well. So what qualities or what skills, what things do you think doctors and dentists need for them to be Good, basically. What do you need? What qualities do you need? Empathy, yep. Good communication, patience, yep. Sympathetic, yep. Open-minded, understanding, good. Thoughtful, yep. Okay, good. So basically, these are a few like qualities and skills that I got off ChatGPT as well. But there are very, very strong answers in there. So strong communication skills. Why do you think we need strong communication skills? Communication skills can range from the patient and the doctor, or the doctor and the rest of the team. The doctor works in a multidisciplinary team. I'm going to be using key buzzwords as well that you can use in your personal statement and your interviews, which will like show that you know what you're talking about. So the multidisciplinary team, the MDT, is what they'll be working in, and good communication is using that to hand over to the next doctor or to, tell the nurse what they need to do, or talk to the occupational therapist or talk to dietitian. Um, Communication used in that way. It's also used with the patient as well. When you're talking to a patient, you don't want to use scientific lingo where they won't be able to understand what you're saying. You want to be as it's called layman's term. You want to use as basic English as you can so they understand what you're trying to say, but also making sure that you're answering all the questions that they may have. Empathy and compassion is good as well because you want to know what the patient actually is going through, right? You want to put yourself in their shoes, you want to know what they're feeling, if they need anything, you want to also answer that. Attention to detail is quite nice as well because in medicine and dentistry, you have little minor details that you really need to focus on. For example, if you have like blood work and stuff, you need to look at the numbers and be very, very specific on how you're looking at them. Because if you're above or under a certain amount of range, it can link to different types of disease or pathology. Dexterity is important as well. Is important in dentistry where because you're gonna be in people's mouths, you're gonna be looking, very your hand-eye coordination is gonna be good. But it also links to medicine as well, where you're suturing or if you wanted to go into surgery. Problem-solving skills is quite, obvious. You need to be able to, a patient will come in and you need to figure out what's going on. You're the main person, you're the detective that will basically tell them this is what's going on, this is how we're gonna fix it. You need to be quite adaptable as well because you don't know what's going to come through the door. You don't know what's going to happen next. You don't know what the person's labs are going to come back as. So you need to adapt and be able to change and be able to make different, have different approaches to different types of situations, basically. You need to be resilient as well. Medicine and dentistry and any healthcare degree or career is very tough. You need to be resilient because you're going to be seeing things daily. You're going to be the application process that you're going through as well is quite tough and long-winded. So you need to show like you're very resilient. These qualities are not just for doctors. These qualities are for medical students as well, for dental students as well, right? That's what people often miss out as well, and that's why I think people will score more on. For example, in your interviews, if you talk about these skills and you link it to a doctor, yes, that's good. But you're going to be a medical student or a dental student first, and if you can link it to that as well, they're seeing that you're not just looking at it as a doctor, but you're seeing it as a student side as well, which is very important. So these are the personal statement questions that you'll get. So why do you want to study this course? Why medicine dentistry? How have your qualification studies helped you to prepare for it? And what else have you done to prepare outside of your education? So I'm just going to go through that. So those are self-explanatory pretty much. And there's different sections you can talk about. For example, your EPQs, if you've done any, your A levels, your extracurricular activities, your supercurricular activities, what has motivated you to do medicine or dentistry, whether that's a family crisis, whether that's, your love to help people and stuff like that. But you don't want to make it too generic as well. Um, so next is basically you guys continued, and this is where you've done your application process, where you submitted everything down, and you're basically waiting. UCAS will update by email first. You'll get an email saying there's an update to your application, but you won't get a thing from like the university straight away unless it's a rejection or you've been put on a waiting list. Um, so the UCAS deadline for medicine and dentistry is 15th of October. So you guys ideally, when you get to this time next year, you guys will need to be, winding down your application, making sure everything is good and you've done everything that you can. Usually you'll start hearing back after Christmas. That's when most like universities will start, sending responses out, whether that's rejections, whether that's interviews, etc. Some may do it before, but in my experience, what I experienced was my rejections, my interviews, etc., happened after Christmas. That's all I got. So next, I'm going to be showing you some like statistics of the places for home students or the international students, and I'm not going to be going through it. I'm just going to leave it up there for you guys to have a look at, and then we'll just move on from here. There's a question that was in the chat as well that I'll answer. Do you think EPQ is worth doing? It depends, honestly, because with EPQ, you can show a lot of things. You can show that you can do research, you'll have time management, you're organized. You can show a lot through your EPQ, and you can show interest in certain like aspects. So if you think it's worth doing, then yes, you can do it. Okay, so I'm gonna also move on now. So when you apply to university, you want to apply very selectively, very specifically. For example, if you have a high UCAT, you can apply to places that will look at high UCATs. For example, if you have a low UCAT, you don't want to apply to somewhere where they look at high UCATs or have a high UCAT cutoff, because then you're just going to get a rejection straight away. Um, so there are some places that have look at low UCATs, you can apply there. There are some that have medium UCAT cutoffs, and there are some that have high UCAT cutoffs. And this is similar to um, A levels, GCSEs, and basically those two things. If you do not meet the minimum requirements, you are not going to be getting anything further from that university. Sorry, I apologize. Um, but you won't be getting anything further from that university. You will get rejection because you don't meet the minimum requirements. If you meet the minimum requirements and you check all the boxes, then go for it and apply. Okay, so next is the medicine. This is for medical schools as well. The low UCAT cutoffs, the medium UCAT cutoffs, and the high UCAT cutoffs. There's also a lot more information on the website, on the Dention website. There'll be a QR code coming up soon, and it'll lead you straight onto that. And it shows you the different criteria that is needed for the different medical and dental schools as well. Okay, so let's move on to the interviews, right? So you've done the UCAT, you've done the application, everything's been handed in, and you've got an interview now, okay? Um, so there are two main types of interviews that you'll get. It's either a panel interview or an MMI. MMI stands for multi-mini interviews, and this is basic. There's a quite big difference. You need to know which one you're going into because it's structured differently and you can prepare for it differently as well, right? What you also want to do is treat the interview like a conversation. You don't want to treat it as an interview itself. Yes, be professional. Yes, have the boundaries as well. But if you treat it as a conversation, it's much better because you're not you're not that worried or stressed about it as well. So the main differences between panel and MMI is basically MMI, it's multi-mini stations basically. You'll have 10 minutes per station, for example. But panel, you'll have two interviewers, three interviewers. On that panel, there'll be different like, healthcare professions, lecturers, medical students, dental students. So honestly, it ranges from what people come up. Also in your interviews as well, what you can possibly have is a task that you might have to do separately. So for example, in my Southampton interview, I had to do a group task and then I went in for an interview. So it just depends. You need to know what you're basically going into. So the physical appearance that you want to have is you want to be wearing smart wear. Your suit, tie, blazer, and a skirt will work fine. Black pants, etc. You want to have if you're a guy, clean shaven beard, tidy haircut, No strong perfumes as well, because if you got too much perfume on, it can be off-putting as well. Then some people don't like it. For girls, hair tied back, neatly put away, smart clothes, blazer, skirt, pants, if you can, smart shoes, suit shoes. And the same applies for online. If you're doing online too, you don't want to be casual. You don't want to have like just a shirt on or jeans, something like that. You want to still have that smart wear on, whether it's suit, tie, etc. Okay, so these are the main differences between the MMI and the panels. I'm not going to go into it too much, but it's right there for you to read and look through as well. But I'll also talk to you, whilst you're reading through that as well, I'll also talk to you about my group test that I had with Southampton. So with my Southampton interview, I had to do a group task where I had to prioritize a task a student had to do, but the examiners and the interviewers weren't looking for a definite answer. They were looking for the thought process that we were going through to get to the answer. That's what they're more interested on. So that's some of the, difference between panel and MMI. And let's move on. So interviews can be online as well, and they can be in person. It just depends what you're more comfortable with. Most universities now let you choose whether to do online or whether to do in person, but there are some universities that will tell you, okay, it's only in person or only it's online. Um, so what it'll basically be is you choose if you're going to interview, they'll tell you a time and location basically, and you choose what day, etc. They'll have a few days, so it's not just a one specific day. They'll have a few, they'll do it over a time period, so it's quite flexible as well sometimes. Okay, so top tips for online interview is have good internet connection. Join the meeting earlier than scheduled time, whether that's 10 minutes before, 15 minutes before, just so you know you're on time. Have a clean, neutral background. Make sure there's nothing like, too flashy in the background, and there's nothing distracting you in the field of view. Clear your desk of any distractions. There are also, I've heard that if you're at online interview, that you don't have any resources. So, for example, some medical schools or dental schools will tell you to show their surrounding, so you don't have anything that you're basically cheating with. Um, have a good webcam if because you don't want to like have blurry images or anything like that. Angle the camera so that it's at your head level with shoulders visible. So you don't want to go too low or to have too high where it's just your head. Um, and don't just wear the top half of the clothes. For example, if you're a guy, you don't just wear shorts as well with everything else on top. Wear the whole suit just to be on the safe side. Also when you're speaking, look into the camera. Don't just look around because it might take, the wrong impression. But just look at the webcam, basically just look into the eyes. That's how you want to think about it. Okay, so I'm gonna move on as well. Um, more tips is look the part. We've already covered that. Make sure you're wearing smart wear, you're wearing good clothes, etc. Um, arrive to a location early. When I went to my Southampton interview, I arrived, I think, 15, 20 minutes early just to make sure I was at the right place at the right time, etc. Have photo ID with you because they will ask for this. And when you're going into the interview, turn your phone off. You don't want your phone to go off and it'll just create a bad impression. Ones with your clothes as well, keep neutral colors. Don't have any flashy colors. Don't wear like a red suit or anything like that. You want to keep, neutral colors, professional colors, basically. And also on that day, like on the day of interviews, I'll be kind to everyone as well, just in case. Because there was a time where I held the door open for someone, and that person turned out to be my panel interviewer. So it can just, go a long way. Okay, so what do you actually need to know for your interviews? Pretty much you need to know everything. Everything that can come up is what you need to know. Having an understanding of what the NHS is, how it runs, understanding what primary care is, what a GP does, what a dentist does, what are the good qualities of a doctor or a dentist. Understanding ethics is a big thing as well. Um, Ethics, the four pillars of ethics or why they're important, what basically happens with your interview, they can ask you ethical questions and you want to give your thought process, including the key ethical pillars. If you don't talk about, for example, justice or non-maleficence, then you're missing out on key points that you can possibly gain. You also may want to know the future of the NHS, what they have planned, and there are 6 C's of the NHS that you want to know. There's also a medical interview book that I got. I'll show it up right now. I got this book that I use for my medical interviews, which is quite good because it's got different answers with key like answer sheets as well. We're also going to be holding an interview crash course as well. So keep an eye out for that, with model answers and everything like that. So how can you prepare for your interview? One way you can prepare is by speaking into the mirror, just having that eye contact with yourself just to make sure that you can speak to someone. And practice is the most important thing that you can do. Get anybody to question what you are doing or like question you basically, whether that's friends, whether that's family, whether that's teachers. The more practice you get, the better it is for you. Because if you can do it with someone, they can give you like constructive criticism. They can tell you what you're doing good and what you're doing bad. For example, when I was going through my interviews, I went to all my teachers, my biology teacher, my chemistry teacher, my careers advisor. I went to everyone, my psychology teacher. I went to everyone and told them do basically a practice interview with me. So the more practice you get, the better it'll be for you. Um, so also if you look at questions online, make a note of the question, make a note of key points and ideas that you can talk about, right? You want to know how to answer a question, but you also don't want to sound too robotic when you're answering that question. So just keep a few points and a few ideas on the side that you know what you're going to talk about. What you can also do is watch other successful candidates and how they, you know, practice with the interview, what they were possibly asked. Speak to medical students, speak to dental students, speak to whoever you can speak to get an idea of what's actually going on. Okay, so what to do on the day, right? You want to be on time. You want to think before you answer. You don't want to give an answer straight away because it'll just show that you're not really thinking about what's going on. Give a handshake to the people unless they are not willing to do so. Um, Obviously, it's for religious reasons as well. Do set off early. Make sure you have the time together because you don't know what can possibly go on, whether it's road work or, just anything that's out of your control. Do bring proof of ID. Make sure you have that. That is quite important. Do not share interview questions straight after. And don't be fazed by curveball questions. Curveball questions are basically questions that they can ask you randomly that no one has ever asked before. They're not interested on the answer that you give. They're interested on how you get to that answer. They're not basically what your thought process is. So don't think about it quietly. Think about it out loud. Do you know what I mean? So that's what you have to be doing. Okay, so that's my bit now, and I'll just hand it back to Aarij.
Perfect. Thank you, Syed. Just before I do move on, there is a question saying, what is the book called? So do you maybe want to hold it up again to the camera just so that they can see the book and they can make a note of it, if that's okay?
I'll write it in the chat as well.
Yeah,
I'll
that's
just
okay.
do that.
Perfect. Okay. Well, thank you very much for that, Syed. So we're now going to be moving on to a bit about just some breaking down some interview questions, just some common ones, and just give you a bit of an idea of the type of questions you can get in an interview, just to put you in the seat, just as you are doing the real interview. Okay, so one of the most common questions that you'll probably come across or that you may have in your actual interview will be, so tell me, why do you want to do medicine and dentistry and not another healthcare career? So these are just some of the key pointers that we think you should really be trying to mention in your answer, just so that the interviewer can just put a tick next to each box so that you get full marks on that station. So first thing we always say is talk about what's drawn you to that career specifically. What do you see and what do you like about medicine and dentistry that's basically pushed you towards a healthcare career? So for example, for me, why am I doing dentistry is mainly because I'm a very outgoing and social person, but I do realize that I need a career which is varied, for example. So dentistry was ideal for me because you get patients coming in through the door every couple, 15, 20 minutes, you can have a new patient. And it's a very varied career. That is not a career where you're just sitting down on a chair at a desk all day. you do have that social aspect, but it is very varied in terms of what you get coming through. The other things you can talk about, for example, and this is another good way to answer for dentistry specifically, is that dentistry, the way dentistry is going at the moment, is really becoming a fusion of science and art. Believe it or not, dentistry is art. Whether you're doing a filling or you're doing some cosmetic treatment, it has to look aesthetically pleasing. And this is something that you could mention in the interview answer, that not only is it a scientific career, that you need to know your biosciences, you need to know, obviously you need to know your dentistry, but you also can express your artistic side to dentistry when you're doing fillings or doing any cosmetic work in the patient's mouth. And then for medicine, you could also say something along similar lines, but I think we all do agree that dentistry is slightly more artistic than medicine. But for medicine, for example, you could just say that it's scientific and social. So bringing it back to that earlier point that I mentioned, you can just say that obviously medicine's built on a scientific foundation, but you could say whether you're working in a hospital or in a GP or doing some outreach, you do have that social aspect. That's one of the key things that you can say. It's not really needed for a long story. Obviously, if you do have a personal experience that's drawn you toward this career, that's absolutely fantastic, and you can mention that. But you don't need to say anything about, oh, since the young age of 5, I've always wanted to be a medicine and dentistry. You don't need to give them a whole life story, basically. They just want some key couple of points just to tell them why is it medicine or dentistry. And then you could also, again, this is for both careers, you could talk about how each day is different. And it's also that aspect of lifelong learning, for example. So obviously each day is different, or even every patient is different. So it almost keeps you on your toes, rather. There's never a chance for you to almost sit back and relax, because you need to be on your toes for everything. And you could also say, for example, that it's a lifelong learning. There's that aspect of lifelong learning that you like. So, for example, the minute you get into medical and dental school, they will always tell you that. I mean, I remember myself, the learning does not stop here. It's only the beginning, because you've basically committed yourself to a career in healthcare. And with healthcare, there's always new regulations, new treatments and procedures that always come out. And if this is something that appeals to you, it's something that you can mention in your interview answer. And one real thing that I do also want to drill in is that you don't want to make it out that medicine and dentistry is the best career, or you're devaluing any other careers. They won't like that in your interview answer. What they really want here is just an idea where you've thought thoroughly about your answer and thoroughly about your experiences, and maybe you can reflect through your work experience and say that this is what's pushed me towards medicine and dentistry. Just set it apart. So, for example, this is what I like in medicine or dentistry, and I acknowledge that other healthcares are really important, but this is what sets medicine and dentistry apart for me. But you do have to acknowledge that they are important. So you can't go around saying, for example, that a classic example is why medicine and not nursing. So in that answer, you don't want to go around saying, oh, well, nurses do nothing. Actually, believe it or not, in most cases, nurses do a lot more than doctors sometimes do. So this would be a fatal error, and you'll pretty much fail that station if you say something like this. So just acknowledge that they're all equally important, but just more importantly, set them apart. Why is it this career over another? Okay. And coming on to work experience, for example, if you do get a work experience, so you may have a station in MMI, or even if you are in a panel interview, you may get asked a couple of questions about your work experience. So what I've noticed is they won't directly ask about your work experience, but they'll try to word the question so that it gives you an opportunity to bring your work experience in and reflect on it. So if this question does come up, and if you answer it successfully, what the interviewer will appreciate and gain from you speaking is what took place in your work experience, what did you see, any notable procedures or patient interactions, but more importantly, what did you learn from it and what did you reflect on? Medicine and dentistry is all about reflection. Even after you graduate and you become a clinician, after every patient, you need to reflect on what can be done better to improve patient care. So even though it may seem really weird that, oh, I'm not even at university yet, and these guys are asking me to reflect, but you need to be showing these qualities so that they know that you are able to be part of the future workforce almost. So try to drill these qualities, and more importantly, try to drill this reflection in, even now, for example. You could start off, for example, so if we're doing a model answer of how was your work experience, for example, you could start off saying how many days it was or how many weeks you did. And then you can give a general overview of the location. So, for example, if it was a GP, you could say it was a community GP placement, or if you were at a dental clinic, you could say you were at a dentist on a high street, for example. So it just sets the tone and the setting for the interviewer. And then this is where your bulk of your answer is going to come in. You want to talk about what you saw. You want to talk about any specific procedures and any patient interactions that you remember. So again, bringing it all the way back to the start of the webinar, this is where your actual log of work experience comes in. Any important patient interactions or anything that you think, actually, I want to mention this in my interviews. This is where you actually pull that log apart and try to remember it for your interviews. And then you could maybe talk about a specific example. So again, drilling back into that logbook example, you could say, for example, how you saw a clinician who had, I don't know, like maybe a little child coming to the clinic, and you can show that how the clinician showed excellent communication skills, not to only make the child feel comfortable, but actually get the procedure done or get the checkup done that was needed. And then finishing the answer off, reflection, reflection, reflection. We always want to reflect. We want to now say that you've seen this, you've been there, but how have you reflected on that? And what have you more importantly done to develop your skills? Because respectfully, in the healthcare field, they don't want a person who find it, acknowledge it, but they don't actually use that information to develop, because it may be a case where patient care is falling short and you need to develop your skills to make sure the standard is met. So actually taking in but not acting on it is just as bad as not reflecting, basically. So you need to make sure that you tell the interviewer, what have you done to develop your own skills afterwards? Okay. And then you can just summarize it at the end. So saying, for example, it's a very valuable learning experience of how dentists operate, and realize that dentist roles in clinic is not only being a clinician, but also a team leader with excellent communication skills. So this is the end of your reflection, where you're saying that it's actually made you realize that a dentist's ability or a doctor's role in the GP, for example, is not only just to treat patients, but it's also the fact that they're a team leader and they need to have these excellent communication skills. Okay. Another common question that you can get is why this medical or dental school? So granted, on your UCAS track application, you're going to have 4 medical or dental schools. And obviously you have that extra backup choice. When you go to each interview, and this is more important for the year 13s right now, you want to make sure that to that interviewer, even though it may not be your first choice, you want to make it look like it is your first choice. Because the competition is so tough these days that the medical and dental schools, they actually want the students that want to be at that university. So for example, I had an interview down south as well, and I wanted to stay in Manchester. But when I was going up to that interview down south, I didn't make it out like, oh, this was my second choice or this is my backup plan. I made it out like, no, I actually want to be here. They want to know that you want to be there, but more importantly, they want to know, why is this school suited for you? So granted, at the end of the 5 years or 6 years, you are going to come out with that medicine or dental degree. Each medical and dental school is, the way they teach and the course structure is slightly different. So what you want to do for this question is pick up on some of the key things that you think you could talk about in the interview that you think would suit you if you were studying there. So for example, let's take the example of medical school, for example. The way the universities are now going is they're now implementing this 3D anatomage table. So gone are the days of having cadavers for anatomy and dissection, for example. But there still are those few medical and dental schools that still do have cadavers for dissection. So you could say, for example, that I want to come to this medical and dental school because of the opportunity it provides to do anatomy with real life cadavers, for example, rather than using 3D and AI and 3D anatomage tables. And you can say how you think this benefits you. So these are some of the key things that you should be thinking about. Granted, it's 5 years at uni. They also want to know that what can you offer other than academics. So for example, the classic way to talk about this is have a look at the society that are on offer at the university. So for example, if I go back to my Manchester interview, for example, I remember in my interview, I talked about they have a club here at Manchester. It's a running club, and I'm very much into my running. So I mentioned that this is something that I'm looking to do. So when I come to the university, I'm looking forward to help out to join the society and start running and making some new friends. So you want to be talking about the hobbies, and then you can talk about the club. So each university does have a students' union website, or they'll have something similar. So for example, if you've got an interview at Manchester, for example, you can just type in Manchester Students' Union, and you can find all the clubs listed there, and you can pick a couple and mention it in your interview. So it does show that you haven't just blindly picked on UCAS track that you want to go there, but you have actually looked at the medical school or dental school, had a look at the course, and you've had a look at the surrounding life, for example. So that can be the clubs, but it can also be the city and the surrounding area. So this is another great way to set your answer apart. And if you are really aiming high, which we all should be, to get top marks in that station, you want to talk about the city. So you could say what's going on in the city. Is it home for music? Is it home for culture? Is it home for arts? Is it home for sports? For example, if you're looking to apply to Manchester, one of the things that I talked about in my interview was football. Obviously, we know we've got Manchester City and Manchester United. But you've also got the Old Trafford cricket ground, and you've got Lancashire cricket team here. So these are some of the things that you can be talking about. And then finally, just bringing it back onto the course again, you can talk about the course structure. So some universities have self-learning, some do early clinical placements, some allow you to do research that maybe other medical and dental schools would only let you do from year 4 or year 5 onwards. So you can talk about these things in your interviews to set it apart and show why you want to come to this medical and dental school specifically. Okay. Another common question that you can get, and this may be weaved into, for example, this question may be weaved in generally. For example, what do you do to relax? It's a great way to talk about your hobbies. Now, you'll be wondering, why do they care about this? Why are they asking about my hobbies? The reason they ask about your hobbies is they want to see that as much as academics and working hard and being in your books all the time is fantastic, but you need to basically be a person. The universities don't really want anyone who's just studying 24/7. They want to basically see that you have a life outside of academics. And there are no extra points in the station for saying a certain hobby over the other. So for example, some people may say that, oh, I'm like the grade 6 in the cello or piano, for example. And some person might just say, oh, I like watching movies on the weekend. Or for example, how I said, I like to go on a long run on the weekend. So the person that said, oh, I'm a grade 6 piano player, they won't get any extra marks in that station than me, who said that I like to run on the weekend. It doesn't work like that. But what you want to make sure, and if you're going to take one thing away from this slide specifically, is don't say anything that along the lines that you only care about medicine or dentistry. Because what they want is they don't want someone like that, because they need to know that you are a person. And that, because if you think about it, if you're just in your books all the time, you may be lacking those social communication skills that are very important as a clinician. So that's why they want to make sure that you do have a life outside of medicine or dentistry. Just be honest. Honestly, that's one of the best things I can say generally for the interviews. But also, if you get a question like this, just be honest to them. And even if it's a really weird hobby to you, it doesn't matter. So for example, if it's something very discreet hobby, it doesn't matter. They'll probably ask follow-up questions about it. And it's better that you be honest rather than lying, because sometimes what you will find is that the universities may follow up with this. So if you say on your personal statement or on the forms that the universities send out before you attend your interview that I can play the guitar, for example, or let's take it back to the piano example, I'm grade 6 piano. What you may notice, if you're doing your interview in person, they will have a piano and they'll ask you to play this song on the piano. So it's just these little things that you need to think about. So yeah, for example, I talk about running, photography, hill walking. These are the sort of things that I like. And just bringing it back to that point where if I said musical instrument, for example, piano, it wouldn't give me any extra points than saying running or photography or hill walking. Okay. So the next type of question, again, these are all common questions that you will get asked and you should really be considering, is tell me a time when you have demonstrated communication skills. And what you want to use for this, and this isn't our acronym, it's a tried and tested acronym that really does work. So it's called a STAR acronym, and I'm just going to break down what the STAR acronym means. So the S stands for situation, the T stands for task, A stands for action, the R stands for result, and the second R stands for reflection. So if we move on to the next slide, you can see a breakdown. So I put a reference in here, obviously, because this isn't our own, and we did take it from a website. So if you do want to, you can have a look at that reference here, and you can do a bit more reading, but we've summarized the key points here. So for example, you may get asked the question, describe a situation where you had to deal with a difficult person, explain how you came to meet that person and why they were being so difficult. So in the situation, what you would do here is describe the situation you found yourself in. So for example, you could say, well, when I was on, for example, when I was on volunteering, or when I was doing volunteering, I encountered a person who was being difficult with me. And then what you can talk about is you move on to the task. What you want to say is describe the task at hand, what needed doing. What did you have to do to fix it? And then you move on to the action, and you want to describe the action you took. So if the person was being difficult, you could maybe sit down with them, have a chat with them, pull them to the side, for example, and understand where they're coming from. So that's the action that you've taken to make sure that you're able to make diffuse a situation, basically. And then moving on to the result, you want to talk about what you accomplished. So if the result was that after having a conversation with this person, they became a lot more calm and a lot more listening and understanding, that's your result. That's what you achieved from having this conversation with the person. And then finally, the reflection. I know we're going on about reflection a lot, but it's really important in your interviews. You want to talk about what did you learn from that experience? And more importantly, I'm going to say it again, what have you done to improve and develop skills afterwards? So there are three main answers that you can use to reflect on the situation. Not all of these will apply to your example. So obviously, depending on what you get from the interviewer, you need to pick carefully what you do with your reflection. So you could say, for example, why is your experience after this experience that you encountered, why has it made you want to do medicine or dentistry? You could talk about how through your experience, what you learned about the healthcare system or career of being a medic or a doctor or a dentist. And then the third thing that you can talk about in your reflection is how will the skills you've gained make you a better medical or dental student? Now, that bottom one is the most common way to reflect. So you could talk about what you've learned, what you developed, and how these skills are going to help you in the future. So I know that was a very quick whistle-stop tour of the STAR acronym and how to answer these types of questions, but you can have a look at this reference if you want, and the slides will be posted out to you later on, and you can give it a more in-depth read, but do make sure to learn the STAR acronym. It really does come in handy for very common questions like this. Okay, now moving on to hot topics. Again, you may get a full station on hot topics. So what are hot topics? It would obviously be related to the NHS, but what we mean by hot topics is they can basically ask anything that is in the current news related to medicine or dentistry. What they're looking to see here indirectly is, are you keeping up to date with the current advances and the current state of the medical and dental field in the UK? So what we recommend here at Dention is make sure to keep checking medical news and reading any new articles, as they can ask, tell me about a piece of news that you have recently read. So some good places that you can find are, for the medics, you can obviously you have normal news outlets. You can have a look under the healthcare, anywhere there. But we do recommend the BMJ, the BDA for dentists, and there's a website called Dentistry, just Dentistry, and there's a lot of news in there for dentists as well. So these are some of the key things that you can look at to keep up to date with news. But even if it's anything that, for example, you've heard on the radio, for example, you could talk about this. It doesn't have to be written news or anything in, I don't know, like the news at 6 p.m., for example, anything like that, just as long as it is true and it's factual, and then you can talk about it in your interview. Well, what they can also ask, so that's one side of the hot topics. So they can ask about, tell me about a piece of news that you read recently. But coming back to what Syed said earlier, touching on the 4 pillars of the ethics and the GMC/GDC guidelines, they want to know that basically you will need to know these. Definitely the 4 pillars of ethics, but you should have a good understanding of the GMC and the GDC guidelines, because what sets apart a really good answer from an okay answer is bringing these guidelines into play in your answer. So depending on what the question is, you could say, for example, in the guidelines, it says this, and this is what I thought about it. So it just sets you apart. And then obviously, as Syed mentioned earlier, you can talk about the NHS 6Cs, and you can also talk about the NHS Constitution. You should look into these. These are some of the key things that you should know. Okay. And then so bringing it back to, if it's a piece of news, you want to summarize the event in question. You obviously you want to make sure you're talking about the key things, but you don't want to spend your whole 5 minutes just talking about the actual news. You want to, after you take a minute or two, talk about it. And then the rest of your answer is going to be spent weighing up the pros and the cons. So, for example, going back a couple of years again, because I'm in dentistry, amalgam in the UK got banned. So one of the interview questions that you could have got asked going back a couple of years is, what is your hot take on amalgam, which is used for fillings in the mouth, getting banned? So you could say, oh, I've actually read about amalgam in the news. Here's what's happening. You could say, I think it's by 2030, I think they're phasing it out or something like that. You could say, you could give some key facts and figures. And then after you spent 2 minutes doing that, the next 3 minutes should be spent weighing up the pros and cons. So for example, with amalgam, it's normally linked to toxicity. So you could say a pro is that there's going to be no more toxicity. But then you could say a con. I know this is all dentistry talk, but I'm just trying to give it in a context for you. And then the con, for example, could be that what it's been replaced with, which is the glass ionic cement, which is being used now for fillings, it isn't as durable as the amalgam that was used. So that's a con. And then you can just give a balanced argument and then just summarize by giving your opinion whether you think it's a good thing or a bad thing. Okay, and then so touching back on what Syed said about tell me. So obviously Syed in his Southampton interview, he did have a group task, but you can also get asked in a interview station rather than actually doing something. You can get asked, tell me how to do something. So for example, this could be, tell me how to tie a shoelace, for example. That's a very common question to get asked. So what the interviewers are looking for in this specific case is they're not looking for a complete answer, because granted, the interviewer on the other side, what they will be is, even though obviously they know how to tie a shoelace, but they'll be very basic and they will need everything explaining. So you'll have to explain, for example, with the laces, you want to grab the 2 lace and show them that these are the lace, and then you're gonna have to show it like you make an X like this, for example. That's the level that the interviewer will be at for this station. But what they're also trying to do is make sure that you're trying to give a methodical and simplistic answer. And this is related to medicine dentistry. So for example, I mean, I was told this week in one of my sessions is that, say, for example, if a patient needs a filling, you're not going to confuse them with all this dental terminology by saying they've got a mesial-occlusal cavity on the lower left 6. All you're going to say to them is that they've got a hole in their teeth. And that's exactly the same idea that the interviewers are looking for in this station. You want to try to avoid using any complex terms or any complex things that make it hard to follow the instructions that you're giving. Try to keep it as simple as possible. And just imagine that the interview in front of you is like a 5-year-old child. Just use 5-year-old child language to make it as easy as possible. But what you must do for these is you must start off by introducing yourself. So you could say, for example, hello, my name is Aarij. I'm a first-year dental student or second-year dental student at Manchester, and I'm going to teach you how to tie your laces today. And then what you're going to say is, by the end of this activity, you should have your laces tied up on your shoe. So you tell the interviewer that, for example, because it's only 5 minutes, if you don't achieve your aim in that 5 minutes of actually tying the laces, the interviewer does know what he was trying to achieve. So it's almost like you haven't left him out in the middle of nowhere, if that makes sense. So you introduce yourself, tell them what you're trying to do and what the end result will be. So even if you don't achieve it in 5 minutes or however long you have for that station, it's not the end of the world because you have explained what the end goal is. So that's one of the key things to take away from this. Okay, almost there, guys. And moving on to prioritization questions. These ones are a bit more from medicine than dentistry. I haven't really encountered any dental schools really asking any prioritization questions for dentists. What we mean by prioritization questions is basically, say you have three patients, you're a GP at a community clinic, and you've got three patients to see, but you can only fit in two due to time constraints. And this is what we mean by prioritization: is how are you going to prioritize which patients will be seen and which patient will unfortunately have to be maybe rebooked in for another time. So what you want to do for these is you want to talk them through your reasoning. You don't just want to go to an answer. You want to make it really simple. You want to say, well, I've got three patients here. I can only fit two in. List the conditions, for example. And then what you can do is you can then just talk them through how you're going to go through it. What they're looking for here is just your reasoning and your methodical manner here. They're not really looking for it. There's no correct answer for these, but they want to see that you're doing it in a methodical manner, really. Okay. Okay. So moving on to a bit of role play. So these role play questions, again, depends where you may get it in the interview. For myself, I had the role play once right at the start, and then I had one role play session right at the end for another university. But unfortunately, what happens is that the majority of candidates for these score really low on cessation. The reason being, when you do go into these interviews, whether it's online or in person, the interviewer on the other side, they'll often be an actor. So, for example, I remember that for one of my interviews, I had an anxious mum who was here with a child for a dental checkup, and I was a first day dentist, so I had to role play this. And because the interviewer was an actor, they put on a really good face almost to start crying and being really sad and getting annoyed. So this is one of the reasons why the candidates score really low on station, because it is a really tricky station. But there is a way around this. You can use something called the spikes method, and this is something that me and Syed have both used when we were applying for medical and dental school, and it does work. It's tried and tested again. So what is the spikes method? Spikes method is basically, it stands for S for setting. I'll come back to spikes in a moment. I just want to cover one more point. It's basically that you need to make sure that you're speaking slowly always. You want to make sure that you're not interrupting the patient when they're speaking, and you want to listen very attentively. So this could be posture. So you don't want to be sitting there with your arms crossed like this, because that's a very defensive method, because that indicates to the interviewer that actually this person doesn't really care. You want to be having a nice open body language, and you almost want to be leaning in, if that makes sense. I know it's very hard to show on the camera here, but what we get taught at medical and dental school, and is something that you can use in your interviews, is when you are ever breaking any bad news, or even if you are with a patient, you want to be sitting at an adjacent angle to them. So you're not almost face on to them, or you're not almost side on to them. You want to be sitting at an angle. It's just what works. Psychology, it's just the way it works. But you also want to have a nice open body language, and you want to make sure that you're not confusing your language. So it comes back to that point. Make sure that you're speaking in simple terms that the patient can understand. But if you are breaking bad news, you want to make sure that you're not promising anything that you can't do. And this is a big red flag. If you do say this in your interview, so for example, if I don't know, you have a patient who needs something doing, but you know that you're not qualified enough to do it, and you say, oh yeah, we'll sort it out for you. You don't actually know that, do you? You can't promise to that patient that you're going to sort it out if you know you can't do it. What you could rather say is that I'll refer you, or I'll speak to one of my colleagues who's a bit more senior or who's able to carry out this procedure. And that way you haven't given any false hope. Because if you give any false hope, and you'll come on to this when you look into the guidelines and just the general medical council rules or the dental council rules, you cannot lie to your patients. It's standards. You lie, it's not allowed. So you want to make sure that you're not lying when you're breaking any bad news. Okay, moving back to the spikes. So S stands for setting the scene. So if you need to break some bad news to a patient, what you want to do is you need to have some privacy. So whether that's taking them into a separate side room, or if you're on a ward, for example, that could be drawing the curtain around the bed, for example, if you're in a hospital, or even if you're in a dental clinic, for example, it would just be in your room. You want to make sure that you do, if they need to have significant others with them there, So for example, if you have a elderly patient, you want to make sure that if they want, of course, it's always down to the patient. You need to make sure that if they want someone there, they are present. Then you're going to get to sit down in the setting. You're going to make a connection, establish a rapport with the patient. This basically means just check up with them, see how they're doing, introduce yourself. And then you're going to move on to P, which is perception for spikes. Now, what P means is you want to understand, what does the patient know about their medical condition? So for example, if, again, bringing it back to dentistry again, if a patient needs a root canal, for example, you need to understand, what does the patient know? So you could introduce yourself by saying, hi, my name's Aarij. I'm a second year dentistry at the University of Manchester. You take the name, date of birth, get their consent, etc. Sit down with them. And then you want to say, so what brings you here today? That's probably the best way to do it. That way, the patient will open up and say, well, actually, dentist, I'm not too sure. I've just been told that there's something wrong with my teeth, and I've been told to see you. And at that point now, you know what the patient knows. So you're not assuming anything. So if you didn't do that and you thought, for example, in this case, that the patient already knew they needed a root canal, if I went in and said, oh, yeah, you need a root canal, you haven't given any warning to them, have you? So that's going to really upset the patient. So that's why it's important to make sure in the P of the spikes for perception, you understand what the patient knows about his medical condition and just get up to speed with where they are with regards to their condition. Then moving on to invitation again. So if you're breaking any bad news, what you want to do here is you want to ask the patient. You're not going to say to them, I'm going to give you your results now. You're going to say, am I okay to discuss your recent lab results with you now? Is now a good time, for example? That's something that you would say. And then at that point, you need to accept the patient's right if they don't want to know now, because obviously it's all down to the patient comes first, doesn't it? So if they don't want to know, you won't discuss it with them. Or if they say, can we do it another time? You'll book them in for another time. You can't just go delivering or giving any results to the patient and you haven't asked. Okay. Moving on to K, which stands for knowledge. So what you're going to do here is you're going to give them the actual breakdown. So after you've invited them to have the conversation with you and you've invited them to let them know their results, you're now going to move on to knowledge. And what you do in the knowledge, you basically tell them what the condition is or what you need to tell the patient. So this could be giving medical facts. Again, we need to make sure if you are in an interview, try not to confuse it or try to make it very confusing for the patient. Try to keep it in simple language as much as possible. So some of the things that you want to consider here is the patient's educational level. So for example, if they have only done GCSEs or if they've only just finished A-level and not gone to university, then you need to adapt the way you're speaking to your patient and the tone and the level of complexity that you can share the medical condition or the issue with to the patient. What you also want to consider is the current emotional state of the patient and also the socio-cultural background of the patient. One other good way which will set you apart in the interviews, I know this is a lot of information, but what you can do is there's something called, and this is something that we use ourselves as medical and dental students, it's called the chunk and check method. So what you do here, when you're giving out the information to the patient, you give it in small chunks. So you start off saying, for example, this has happened. Can you repeat back to me what I've said? So this way, you're checking that the patient does actually understand and he knows what you're saying. And if there's something that he hasn't quite got correct, you can correct them there and then. And then moving on, you want to be mindful of emotion. So we often say you don't want to sympathize with patients, you want to empathize with patients. So this could mean just, if you're breaking bad news, just being a bit empathetic, having a box of tissues next to you, giving that patient that a bit of extra time that they need, giving the patient time to express their own feelings to you and respond in a way that demonstrates that you do have that connection between you and the patient. And it's not almost that you're just giving them news and just saying, right, you need to go, because that's not acceptable. But it's just these little things that you need to be mindful of with the emotion. And this also comes back to body language and how you present yourself. Okay. And then summary is basically, you're just going to close it off, say, thank you very much for your time. This is what we've discussed. And then you can ask if they want to clarify anything else, or you can say, If there's something that you need to follow up, say we'll follow this up for you and let you know. But yeah, that's a breakdown of spikes. Okay, moving on. We're almost at the end of interviews now. I've just put this in here. This is more for the dentists than the medics. So my interview down south was at Plymouth, and what they did is it's not uncommon. What some universities will do more for dentistry because it's all about manual hand dexterity and hand-eye coordination. What they may ask you to do sometimes, and what they asked me to do for Plymouth is they asked me to do some origami. So they did send you the instructions out, and you could practice as much as you want. But what they did ask is during your interview, they had sheets of paper there, and you had to make it for them whilst they were asking questions. This is something that you can be very mindful of, but we will be going into this into more detail in our interview crash course coming up in a couple of months. So do keep an eye out for that. Okay, that is the end of the interview section. We're just going to talk a bit about accepting your offers, UCAS track on results day, some general A-level tips, and then we'll be there at the end. I'm going to pass over to Syed now. I know we're an hour and a half in, but you guys are doing really well. I'll pass over to Syed and he'll take over and tell you a bit about accepting your offers.
Okay, so once you've had your interviews, once you've had offers come in, you might have it for one university, you might have it for two universities, you might have it for three, or you might have it for all four. What you need to do is you need to decide which two you want to pick. So you'll have something called the firm choice and you'll have something called the insurance choice. So the firm choice is the first choice that you want to go to. For example, if I had offers from Manchester, Southampton, Liverpool, and Leeds, for example, I would want to choose out of them for which two I want to focus on and go to. So, for example, I'll put Manchester as my firm and I'll put Leeds as my insurance. Okay, so insurance just means the backup. So realistically, what most students do is, for example, you need three A's for Manchester, but you only need AAB for Leeds. What they'll do is they'll have that difference. So just in case comes results day, you don't hit that three A's, you hit the AAB, you still have that insurance, you still have that safety net to go to Leeds and to do medicine or dentistry there. Um, so both places will be safe, both places will be reserved for you, but the other two that you'll have, those will be voided then. Um, and that will be it for that. Um, yeah, so realistically, what you want to do is for your insurance. Okay, so I'll explain it again. So your firm choice is the first choice that you have, and that, for example, will be the higher grade for your offer. So, for example, if you have an offer for three A's at Manchester, and then you have another offer for AAB at Leeds, you would want to do Leeds as your insurance choice, as your second choice, but Manchester as your first choice. For example, come results day, you get AAB, you still have that safety net to go to Leeds. Does that clear up a little bit more? Um, but yeah, that's the main bit. I'm going to move on to the next slide. So what comes up next is that results day is on the 13th of August. Okay, and you'll figure out, okay, this is what you want to do, and you'll figure out if you got into university or not, basically. You'll need to look for accommodation if it's far away from you. For example, I live in Preston now because the commute for me wasn't worth it. You need to look at the pros and cons of things as well. Um, Look at the location, look at the distance. If you're able to commute, go for it. If you're not, then look for accommodations early because closer to the time that it gets to September, the harder it is to find accommodation. There's a lot of forms and everything that you'll have to fill out and sign just to make sure that you have secured your place. Um, so the results come out at 8 a.m. in person, and but they'll update at 9 a.m. online. Um, you'll also hear back from your university around 8 a.m. as well. What happened to me on results day was on results day at 8 a.m. I was in line, but then I heard back from my university first, and then I got my results. So it just depends on how you want it to go. You can just ignore the email and get your results first, or you can just open up the email. Um, so whether so I'm gonna come through clearing now. So let's say you don't get the grades. There are sometimes medicine and dentist courses that may go into clearing, but that is very, very rare. So what you can do is go into clearing for a different course if you want to go into uni straight away. Or what you can do is choose go down the route of taking a gap year and resitting your A levels. So those are your two main choices that you'll get on results day. Whether you want to resit or whether you want to take reset and take the gap year, or whether you want to go ahead and go into a course at university. Um, so what do you do in a gap year? Basically, you'll do the whole course again, the whole year exams again, but it'll be you doing everything by yourself. You won't have your teachers, you won't have your lessons that you'll be going to. Um, and that will be that will be that in the gap year basically, where you'll just revise and do everything by yourself, and it'll just be that. Um, so yes, you what you'll do is you'll call up the universities, you'll have a clearing number that you can call, and you can apply to any single university that have that course in clearing, for example. So on results day, I applied through clearing and I got in to a medical scientist foundation. Um, and I didn't apply to UCLan at all at that point, and I didn't do anything. And they just asked me a few details, my name, my grades, etc., see if I was a match, and then I was able to get into that course. Okay, let's move on to gap years and what to do during your gap year. In your gap year, right, my top tip is that you're not learning the content again. Hopefully, first you don't get into the situation, but if you do, you're not learning the content again. You're reviewing the content and making sure that you're increasing your knowledge on it. So you may have not got the grades because, your revision technique was wrong. What you can do is work on your revision technique and change it. For example, if you didn't use past paper questions whilst you were in year 12 and year 13, you can go back in your gap year and work on those past paper questions because past paper questions realistically should be your very best friend, your only friend in the 2 years of A levels that you should have. Um, so what you can also do is work a part-time job because when you want to go to university, university is expensive, living out is expensive, commuting can be expensive, it can be quite a lot. So saving up a little bit of money will be good as well. What you can do is also go traveling, rest up in the gap year because you've done 2 years of A levels and those 2 years are the most you would have worked. So have a little bit of a break before you go back into studying and stuff. Um, and you can take that break. It's not a bad thing to have that break. You can also reset and you can also just push through it and realize that yes, university is the thing for you that you want to do and you want to go into this course. Going on to past paper questions as well. When you come to resit, like I said, past paper questions should be your best friend, and the mark scheme should also be your best friend. The mark scheme is basically telling you how the examiners want you to answer questions. And once you do enough past paper questions, and once you look at enough mark schemes, you'll see a common like trend. You'll see a common like buzzwords that the examiners want you to use in your answers to get those marks. Okay, when it comes to resetting your A levels, you will be as an external candidate, so you won't have your student ID. Okay, you will need to bring a photo ID for it, whether that's your passport, whether that's your provisional license, or if you have a driving license at that point, um, you will need to bring it then. What you'll need to do on results day, if you choose to resit, is go to the head of exams or go to your exams officer and tell them you want to reset. Resitting is about £380 for all three of the exams. That's 9 papers in total. Um, and what you can also do is ask your college if you can come back for extra revision sessions, just as a visitor or something, so you can, brush up on anything that or ask or your teachers any outstanding questions that are not being answered, sorry. As a rule of thumb, you want to start working through all the content by January time. You want to make sure you're sitting down, you're focusing, you're doing everything by January, and you want to make sure you're doing as many questions as you can. I can't emphasize the importance of questions. As I've seen most of you guys in year 12, even if you start now with the past paper questions, you will be fine. You will be doing very well, and you will hopefully get the predicted grade that you need to apply. So, general A level tips is what I want to move on to now. When you're in year 12 or when you're in year 13 as well, start by December. You don't want to start like any later than that because there's a lot of content that you need to go through, and the content can be quite difficult. So you need time to understand, you need time to like, make sure you're going through it all, basically. There is a jump between year 12 and year 13. And the main principle is to understand the year 13 content, you need to understand all of the year 12 content. Think of it as building blocks. If you don't build that foundation in year 12, it's hard to build anything on top of that when it comes to year 13. Once you've gone through all the content or most of the content, you should start doing past paper questions, get an idea of what the questions look like, get an idea how they are asked, how they are answered, use mark schemes, look at the examiner comments as well. Look at where most students went wrong using the examiner comments. You can do active recall with Anki. You don't do anything passive, basically. Highlighting is passive, note taking is passive. Just reading is passive. It's not going to help you in the long term. So you want to do active recall, spaced repetition. It's tried and tested. Those who are in psychology as well, you'll learn about in psychology. It's tried and tested, and it works with a lot of people. The CGP books are good as well for basic understanding, but if you want the deeper understanding, past paper questions, YouTube videos are very, very good. So also to continue on with A-level tips is there are online resources that you can use. So I'm not going to read every single one out, but here's a list of all the resources that you can use. There are quite a few that I've used as well, and Aarij 100% has used these as well. And these have worked for us, and these have like basically worked for us. There's a question about physical online flashcards. It depends. Whatever works for you, go for it. In my personal opinion as well, make your own flashcards. If you want to make flashcards, don't use anyone else's flashcards because everyone has their own way to revise. Everyone has their own way to make flashcards. Make your own flashcards. Um, that'll be a lot of work. That'll work a lot better for you. And to save time, I think I'll do online flashcards if anything. To move on as well, there are other resources that you can use as well. Again, not going to read through it, but it's all there for you, and the PowerPoint will be sent to you guys afterwards as well, so you can have a look. So, how to relax during the year, because that is quite important as well. You don't want to get burnt out. Me personally, I'll share a story that I got burnt out quite a bit because I didn't relax that much. I didn't, take breaks. I didn't do anything like that. So by the end of first year for me in year 12, I was very, very burnt out. Um, and I didn't have enough like techniques to manage my time, etc. So in year 13, I learned all of that and I learned from my mistakes. And then I went out for like, football sessions with my friends, just chilling with them, going out to eat, going doing things with them, just taking my mind off education. It plays a big role in your mental health. So I think have that time to breathe and go out of education, and then you're able to focus a lot more once you're back and revising. So I'm going to move on now, and I'll pass it back on to Aarij.
Yeah. Okay, thank you, Syed. Almost there, guys. Just got a couple of sides there. We did advise parents to join along as well, but even if you are not a parent, if you are a parent, thank you for sticking around with your child. Obviously, we're not parents yet, but if you do have any queries at all, or even if you are a student, you can reach out by scanning this QR code. Just take a screenshot now and you can do it later. It's just a Dention WhatsApp. We do have a group chat on there, so we're trying to run a nationwide group chat with anyone applying to medicine and dentistry. So it's just a group chat where you can basically all go through it together, and it's just nice to have some friendly faces in there. And as you sit in interviews, UCAT if you're in year 12 coming up, and then A-level exams, you can all go through it together. But yeah, that's a QR code for that. And then just a bit about some upcoming events. We're almost there now. We are working on a Manchester MMI. So if you are in year 13, you'll obviously have interviews coming up. We are to announce a date for that. We are trying to sort something out for that. But we're looking forward from that. We do have a A-level webinar coming up. So this is more for year 13s. But year 12s are welcome to join along as well. This will hopefully be sometime in March. It's just going to be working through some exam questions for biology, chemistry, psychology, and just some general A-level tips, a bit more than what we've talked about here. Obviously, we brushed over it, but we'll go into a bit more depth on how to actually use past papers, active recall, Anki, flashcards, stuff like that to make sure that you do convert those offers into a place come September. And yeah, all I want to say is just keep an eye out on our social media and YouTube channel and the website, of course, for tips. You can also visit our website and sign up to our newsletter now as well. We will be sending you emails every couple of weeks, just relevant to what you're going through at the moment, and it will be relevant to your application year. But we are going to add more events as we go on. And then just finally, before we move on to question and answer section, these are just some QR codes, so that's for the website. We would really appreciate if you fill out that feedback form for us. This is one of the first events we're doing properly. So we obviously want, Dention is here to serve you guys and make sure that you do get into that medical and dental school place or wherever you're looking to go, even if it's just for some general A-level tips. So we would really appreciate if you can give us some feedback. It's not a long form, it's just a couple of questions. They're all just tick boxes and just what do you rate it? It won't take long, just so that we do know what we can improve on for you, but also for the next years that come after you. And then, yeah, just a QR code for the website and the newsletter. We've got about 15 minutes or so. So I'll come off the slide here now, and feel free to put any questions in the chat if you don't want to speak. But me and Syed will hold on for another 15 minutes, and we're literally open book, ask anything you want. Obviously, we've been through what you guys are going through at the moment. We've both done gap years. I've done a gap year. Syed went straight on, and I've also resat my A-levels as well. So if you've got any questions regarding that, or even if it's just some general advice that you're looking for, do feel free to pop your hand up and we'll come round, or just put it in the chat. But yeah, that's pretty much it. If you don't have any questions, you're more than welcome to leave. Thank you so much for sticking around. I know we're approaching the 2-hour mark, but you've done really well to keep focused for such a long time. And we really do appreciate your time. Thank you very much. Okay. I'll stop sharing now. Yeah. I'll stop sharing now, and then we'll just hold on for 10-15 minutes. Ask away. Don't all ask at one time. But no, do ask away if you do have anything at all.
No problem, no problem.
So there's a lot of year 12s. Have we answered every question that we had as we were going along? Yeah.
There's one right now if you want to answer it.
Yeah, I will have a look. Can you please again show the WhatsApp QR code? Yes, of course I can.
Okay, for revising some flashcards, do you recommend revising exam questions more? So what you can do is, for biology and chemistry, right, even psychology, the exam questions are split up into 3 sections. So you got AO1, AO2, and AO3. So AO1 is literally just knowledge, your straight knowledge that you can bring from the textbook or from your revision to the paper, right? AO2 is application based and AO3 is evaluation based, right? So AO1 is what you can put straight away into like flashcards. For example, what is a monomer or what are carbohydrates, etc. You can put that on a flashcard straight away. AO2 you can put, but it's just a bit harder to answer. It'll just be a longer flashcard. Same with AO3. So you can, I think, if you do past paper questions more, I think that'll be a lot better. What do you think, Aarij?
In terms of doing flashcards, I think you obviously need to know your core knowledge. There's honestly, what I always say is you can get to knowledge, you can get a grade C in A levels. So just say you learn your content 100%, you can get a grade C. So that can be through your flashcards. But what I would say is if you are looking for those top grades, obviously, because you are looking to apply for medicine dentistry, you need to make sure that you are doing those past papers. So do flashcards. Use the flashcards to make sure you know the content inside out. Once you know that content inside out, move straight onto past papers. During my gap year, and because obviously I took a gap year straight after year 13 because I didn't get in first time round, I had an offer, but I missed out on results day. But what I did is I didn't really touch much content. So I did content for about 2 months using flashcards. And then I know we said January, that's for a normal application cycle. I started past papers in about November time. So it just shows you that to get from that knowledge of grade C with your flashcards to get up to that A or even A star in this case, that's how much time you should be spending on your past papers. Because what I noticed when I went in second time around to do my A levels again, they weren't the exact same questions, but I could almost picture the mark scheme, if that makes sense. I know it seems really weird, but you do get to that stage when you do so much. It's a cheat code. Honestly, I don't understand why enough people don't talk about it. Learn your content, just move straight onto past papers and just spend all your time doing past papers. Because when you come to the exam, that's why I said go back to 2010, because they will repeat some questions, but just in a different word. It may be a different unit. So, for example, I don't know, it may just be different numbers in the question, will be the same question. There's only so many questions they can ask you. One last thing I want to say on that is that when I was doing the A levels, there was something I think it's still around. So we did AQA for pretty much everything apart from psychology. AQA have this rule that they have to visit the content in the exam papers every 3 or 4 years. So, say for example, if you look at the last 3 years of papers and there's not a certain exam question hitting the specific specification point of the spec, you know that it's going to come up in your exam year. So that's another way to kind of guess what's coming up on the exam. Which are these little tips and tricks that will set you apart?
Yeah, I agree. It's just that same thing as well. Once you look at mark schemes, once you look at all those papers, it's like you'll see like the common stuff that come out. Like I had said, they can ask questions a certain amount of time. That's it. The answers will be the same, but the question will be different. That's it. That's all it
Yeah.
is.
Yeah. And Syed, what do you make of predicted papers? So do you
Predicted
recommend?
papers,
Yeah, yeah,
I think do it just for the practice. I think it'll be
yeah,
very good as well. Whether it comes up or not, whether it's actually predicted or not, it's irrelevant. Just
yeah,
having that practice in is the main bit.
yeah.
That's all it is.
Basically, it's just another case of doing as many questions as you can. So whether it's predicted or some YouTube video from like, for example, Miss Ashridge used to do it for biology. If it's like, or she thinks these papers are going to come up next year in the next test, in the next exam, just do them. The more practice you do, the better off you will be. But what we would say is please don't bank on the predicted papers having the questions coming in the exam, because often, if you will, probably 95% of the time, they probably are just guesswork. Like we said, if you look at the spec in the last 3 years, if there's a certain question that hasn't hit that spec point, that's how they form the predicted papers. So don't just bank on predicted papers for your exam the next day, basically.
Because they can ask questions again, like so much from the year before, they can ask the same topic again in your year. So again,
Yeah.
just don't go off predicted papers, etc. Thank you so much.
Thank you, Serene. Really appreciate it. So
Aarij, do you
if you,
want to?
yeah, so the question is, if you get offers from uni, when do they tell us? I think you mentioned this before, but I forgot. Also, if you get zero offers, what do you do? Okay, there's two parts to that question. If you get offers from uni, when do they tell us? So remember that the actual UCAS, like the you need to put your offers in. I think it's about end of May, June time. You need to basically confirm what you're doing on for September come forward. So the universities have to let you know by that time. Some universities are really horrible. I'm just going to be completely honest. I have heard stories where you go do your interview in November for medical or dental school or even December, and you don't find out until May because some universities don't send out offers as they go. They will interview everyone and then they'll send out their offers. So again, it depends on the university, but you will definitely have your answer from that university by mid-June, mid-May, start of June time, really. And in terms of also, if you get zero offers, what do you do? Say, do you want to take that one?
So if you get zero offers, there's two routes that you can go down. There's either the route of where you can take a gap year and reset, or you can go through clearing and apply to a course through clearing. So there's honestly two routes. It just depends what you want to do and what you feel like doing. For me personally, I went through clearing. Aarij resat, and I personally didn't want to resit because I felt I would be staying in one place, so I just chose to move on, and try to pursue medicine in a different way, the non-traditional way, which still worked out. But honestly, it just depends on you. But you will find out whether you've got offers or not well before like results day, so
Yeah.
you don't need to worry about having no offers in results day, basically.
I think one more thing I just want to add to that, thank you for that, Said, is there's no guarantee, and I'm not trying to make you guys sad at all, but unfortunately there is no guarantee that if you take a gap year, you will get an offer. Again, if you look on the Dention website, there's more information on this with regards to what to do for a gap year. But unfortunately, just because it is so competitive, some universities, for example, Liverpool. So when I applied second time round, Liverpool just said to me straight up, "We don't want you. Come with your achieved A level grades this time and your UCAT." So that would have been taking out 2 years. So some universities just straight up say that because you didn't make it in first time, and obviously my situation was different because I didn't meet the required grades. But what they will say straight away basically is that you won't get in. So it's not guaranteed. But again, if you do your research on it, you will be able to find out if you stand a good chance or not. But yeah, if what I would say, if there's a will, there's a way. And even in both of our cases, it was so remote chances, let's be honest, for us to get in. Obviously, with Sai doing a different route of getting into medical school, with me having to resit all three A levels in a year, do UCAT and all that, etc. It was a very remote chance. But if we can do it, I'm sure you guys can do it. And we aren't exactly the cleverest of the clever. Maybe we work hard a tiny bit, but if you work hard, I'm sure, and you guys have got the brains as well, you will get to where you need to be.
Yeah.
So don't be disheartened by it, but do your thorough research after you find out what you're doing for that next year.
I think as well, you have to apply very strategically. You have to see where your strong suits are and where you're like where you're weaker at. For example, if you have strong A levels, apply to somewhere that looks at A levels a lot more than anything else. Or if you have a strong UCAT, look at somewhere where they look at UCAT a lot more compared to where they don't look at UCAT at all. So it just depends where you have to apply, and you just have to do your research, like I was just saying, do your research, make sure you do. Don't just apply because it's a big university. For example, Manchester, Edinburgh. Don't apply for the name. Apply for where you think you've got the highest chance of getting in, and that will help a lot.
Like, granted, at the end of the day, just going off what Sadie said, you are going to come out with a medical degree. I know it's not ideal, maybe we're moving away from home, but look at what you are achieving at the end of it. Obviously, at Dention, we are very big on applying strategically. So we have listed the majority of medical and dental schools on the website. So you can have a look there. Yeah, that's okay. No worries.
And you just to answer your
Mhm.
question, so in my GCSEs, I got a range from six, sevens, and eights. There's
Yeah,
also that myth as well that you don't have to get nines, all nines, just for medical school. That's a very big misconception. I didn't hit one nine at
I
all.
got 1.9 and that's it,
Yeah,
literally.
exactly. There's a very big myth about that. But like I said, I applied very strategically. I looked at what places, looked at A levels and UCAT a lot more compared to GCSEs. So that helped me out quite a bit as well.
And what would
Worries.
also say, obviously, look at each university. Again, I'm going to plug the Dention website again, but it's literally honestly everything is on there on the website. You can, so for most medical schools, we've listed what they need. So, for example, most medical or dental schools now they ask for a minimum of 7 grade 7s and above. And they obviously want that in the maths, English, and the sciences a minimum. And then it can be humanities, RS, language, for example. So that is something that you can find on the website. But yeah, I'll just pop it in the website and I'll put the website in the chat if anyone's after it.
There are some universities that also look for a six. There are some universities that also look for a five,
Yeah.
right? For example, Leeds, they take five in English, maths, and language, right? But they also will have them higher stuff that they'll look at, for example, UCAT A levels. So honestly, just do the research. That's genuinely all that we can say. Look at different websites. The Dention website has everything on there. You know,
We
like
spent the
we
whole
spent a
summer
lot of
building it.
time. Yeah, exactly. We
Yeah.
spent a lot of time, making everything, doing this all for you guys. So make use of it, do all the research. If anything, go back to the university's website once you look through our website. but just do the research. That'll be very good.
So
What
what
did
did
you
you
do?
do for your work experience in volunteering? That's a nice question.
Okay, so for my work experience, I did 1 day in a GP. But my volunteering was a lot more. Um, and like Arid said when he was talking about the work experience section as well, it's quality over quantity. So in my 1 day of GP, I got so many skills and attributes of a doctor and how the doctor managed to like do everything that I was able to talk about in my personal statements and my interviews. I did around my volunteering lasted from around I think January to like early October. Just until like the deadline of the application process. So I did very long-term volunteering, but and then I did food bank. I did like 2 weeks in a food bank,
I think you did
and that was
hospital as
basically
well, didn't you?
yeah. So that was the
Yeah.
volunteering
Yeah, yeah,
itself
okay.
as well. Yeah.
Yeah, yeah. Okay.
So honestly, like I was just saying as well, long-term volunteering does help a lot because it shows commitment, it shows dedication, it shows time management, organization, it shows quite a lot of skills by just saying long-term volunteering or just talking about that.
Yeah.
What was yours, Arij?
So for work experience, I only went to one dentist. Funny story, the dentist I went to is actually my own dentist. So that was nice to go back and do it that way. So when I was applying first time round, lights are going out. That's there we go, the back. That's okay. So when I applied first time round, I did a week with my dentist. That was literally just Monday to Friday. I think it was 8 till 4:30, just flat for the whole week. And then when I was applying second time round, I just did an extra 3 days. So if you are taking a gap year or you are resitting your A levels, what the universities also want to see, and again, we'll touch on this in our future webinars, is they want to see what you've done in that year out. They don't just want you to say, oh, I'm just reapplying. That's not enough. They want to see that you've developed your character. So whether that's doing more volunteering, more work experience, picking up a paid job, I don't know, picking up a new hobby, for example, that's the sort of things that they want to see. And then in terms of volunteering, funny story, I am still currently volunteering at the place that I started at in year 12. So it just shows you that the relationships that you do build doing these things will probably last you for a very long time. But I volunteer in like a shop at the moment. And then I also did some volunteering at a hospital. Yeah. So what we're just showing is that even with the volunteering, it doesn't have to be just in a hospital. For example, in my case, it was at a shop and I'm still there. So it's not what setting, it's more what did you learn to communicate with people in this case. But no, yeah. What's a good
Even with
place to,
like,
yeah.
sorry to
No,
cut you
no,
off. Even
that's
with
okay.
like work experience volunteering, even if you got a part-time job, you can include that in, and there's a lot of skills that you can transfer from your part-time job to like medicine or dentistry. Um, so honestly, it's more about quality over quantity. Again,
Yeah.
like it doesn't have to be pure hospital or dental clinic or GP, anything like that. It's anything in a caring environment is what they're really looking for, to be honest.
Even as I mentioned before, Erica, like even if, for example, I tutor on the side, so I have children from the ages of 4 to 16, even that shows it's just whatever qualities you can link for your interviews that they want a good doctor or dentist to have. So, for example, communication, adaptability off the top of my head. What else can you have? Like body language where the child changes normally. Your tone changes with the child. So these 4 or 5 things are things that you could even pick up from a job like this to mention in your interviews.
Even in when we were in year 13, we
Mhm.
were tutoring the year 12s.
Yeah, we were.
So I talked about that in my interviews as well. I
Yeah,
talked about that in my personal statement, and it just shows a lot as well. What are
perfect.
good places to volunteer at? Honestly, wherever you can get volunteering, genuinely. Like I was done it in a shop, I did it in a hospital. For me, it was harder to get because it was hospital. I had to apply twice, and then I got it. Um, but anywhere that you can get volunteering experience that can show long term and that's in like a caring environment, that you'll be gold. You'll be good.
I would put it all on the Dention website, but it's going to take forever to the whole of
Yeah,
UK. I don't know where you're based. But what I would say, the best port of call is to go to your school or college or sixth form.
yeah.
You should have a careers advisor there, and they are probably well versed as much as us in the application to medical and dental school. And they will know that you need some sort of volunteering experience. So they will have a list just like a document with a list of names of where you can volunteer. That's probably the best place to start, really.
Yeah, I agree.
Perfect. I think we'll give it another minute and we'll round it up in 2 minutes or so and we'll end. Any last question,
Enjoyed
guys?
it though as well. Hope
Yeah.
you guys learned a bit.
Yeah, so last closing remarks. Obviously, if you need anything, you can reach out through the website. The emails are manned by me and Syed pretty much. Or you can even get in contact through probably WhatsApp is probably the best place. It's just because it's easier for us because obviously we're out most of the time in hospitals and clinics and uni. So we don't always can sit down and write a formal email, but WhatsApp, we'll be there to advise if you need anything. And yeah, we just wish you the best of luck with everything. And yeah, hope you get
There's
into
WhatsApp, there's the Instagram page as well.
yeah, TikTok
There's
as
a
well
lot that you
recently.
yeah, exactly. There's
There's
a
a
lot that
lot.
you can connect us with.
Yep. Not a
Thank you so much,
problem,
everyone.
guys. Thank you so much for your time. We really appreciate it.
Take care, everyone.
Thank you. Take care.